I'm Rosalind Raine. I'm Professor and Head of Department of Applied Health Research at UCL and a public health medicine doctor. My research measures social inequalities in access to, use of and outcomes from NHS care and public health. We all work together with the staff of the NHS and with users of the NHS in order to conduct the research that will actually have a direct impact upon the NHS. The world is still unequal, our society is still unequal, access to care is still unequal, which is why we always have to stay very close to various communities to ensure that we're addressing their needs. And that's something that I do feel passionate about. And we've got to carry on listening to the communities that we serve and ensure that the mission of the NHS does not stray. For example, some of our research has shown that older people may be less likely to be referred for care, even though, and we have shown this, their outcomes are just as good as if comparable groups of younger people get that care. So there's no reason why older people in these circumstances should not get the care that they need. We've shown that people from ethnic minorities may be less likely to receive certain forms of care. And we found that women may be less likely to get certain treatments. And in all these cases, these differences are unequal and they're unfair. What we might not be so aware of is that more socially deprived people are also more likely to have most conditions. They're more likely to suffer from them. They are very often more likely to present at a later stage and so have more severe illness and therefore to also have poorer outcomes, which means that it's even more important that the NHS make sure that we improve health and care and outcomes for everybody and that we make progress in that, but that we especially make those improvements for the people with the greatest needs. The relationship between UCL and the NHS is absolutely crucial. In my department, we are a multidisciplinary mix of clinicians, statisticians, epidemiologists, health economists, anthropologists, natural scientists. I could go on. It's a very happy mix of extremely committed people who are committed to doing the best research, committed to making an impact, and they're all committed to social justice and to reducing inequality. It means that we learn all the time. We learn from each other, we learn new methods, we learn new perspectives, we learn new ways of doing things, and we learn how to make sure that we will do things that will actually make a difference.